Welcome to Obstetrics and Gynecology Made Easy. In this video, we'll cover the safest and most effective treatments for managing a productive cough during pregnancy. From natural remedies to evidence-based medications, we've got you covered. Stay tuned for practical tips to keep you and your baby healthy and comfortable. Before diving into the treatment options for productive cough, it's important to first distinguish between expectorants and mucolytics. Expectorants. These medicines help the body get rid of mucus, phlegm, by making you cough it up more easily. They increase the amount of mucus in the airways or make it less sticky, so it's easier to cough out. Mucolytics. These medicines break down the mucus in your airways to make it thinner and easier to clear out. They chemically break apart the thick mucus, making it less sticky and easier to remove. First-line treatments, safest for pregnancy. Evidence-based. These are considered safe based on extensive evidence and minimal systemic effects. Expectorants. Saline nebulization. TGA category. B2. FDA. Not classified. Saline nebulization, 0.9%, is a normal saline solution used to hydrate airways and loosen mucus. It provides moisture to the respiratory system but does not have a strong effect on thinning or drawing out water from the mucus. Honey. TGA FDA category. Not classified. Dose. 1 to 2 teaspoons of pasteurized honey up to 3 times daily. Mode of action. Coats the throat, reducing irritation. Recommendation. Use pasteurized honey to avoid the risk of botulism spores. Mucolytics. N-acetylcysteine. FDA category. B. TGA category. B2. Acetylcysteine 200 mg Mucobrave 600 mg. Oral dose. 200 to 600 mg 2 to 3 times daily. Total daily dose typically 600–1800 mg. NAC is considered safe during pregnancy for critical conditions like paracetamol toxicity, offering antioxidant and mucolytic benefits, but should be used only if benefits outweigh risks. Hypertonic saline nebulization, 3% or 7%. TGA category. B2, FDA category. Not classified. Hypertonic saline nebulization, 3% or 7%, has a higher salt concentration, drawing water into the airways to thin mucus and improve its clearance. Herbal and natural remedies. Thyme extract. TGA category. B2, FDA category. Not classified. Bronchicum lozenges and thyme syrup. Dose. Lozenge dose. 1 lozenge every 2 to 3 hours. Up to 6 lozenges daily. Syrup dose. 5 ml 2 to 3 times daily as per product label. Evidence. Safe in moderate amounts. May cause allergic reactions in sensitive individuals. Contains thymol with antimicrobial and soothing properties. Marshmallow root. TGA category. B2, FDA category. Not classified. Ivimunin Pro FU syrup. Both contain marshmallow root extract, thyme leaf extract, honey, ivy leaf extract and vitamin C. Dose. 5 to 10 ml syrup up to 3 times daily. Or steep 1 to 2 teaspoons of dried root in hot water for 10 to 15 minutes and drink 1 to 2 cups per day. Mode of action. Soothes irritated mucosa. Evidence. Safe when used in moderate amounts. Second-line treatments. Moderate safety. Use with caution. These are generally safe but require cautious use due to limited evidence or potential side effects. Expectorants. Guaifenesin. TGA category. A. FDA category. C. GC-mol sachets Expectosolven 600 mg. Dose. 200 to 400 mg every 4 hours. Not to exceed 2.4 grams per day. It is recommended to use the lowest effective dose for the shortest duration. Generally safe in short-term use, but should be used only if the benefits outweigh the risks in the first trimester. Ivy leaf extract. TGA category. B2, FDA category. Not classified. Ivipront and Ivirospan syrup. Dose. 5 ml 2 to 3 times daily as per product label. Evidence. Safe in moderate amounts. Avoid high doses due to potential gastrointestinal side effects. Mucolytics. Bromhexine. TGA category. A FDA category. Not classified. Some studies propose it as category C. Bisolven 8 mg, bromhexine 8 mg. Oral. 4 to 8 mg 3 times a day, depending on the severity of the condition. First trimester. Use with caution, as limited data is available. Second and third trimesters. Generally considered safer when used cautiously. Sobrerol. TGA. FDA category. Not classified. No adverse effects reported. Limited pregnancy-specific studies. Dornase alpha, pulmozyme. TGA category. Not classified. FDA category. B. Safe for specific conditions. Cystic fibrosis. Its use for general cough is limited, and there are no extensive studies in pregnancy. Carbocysteine. TGA category. Not classified. FDA category. C. No known teratogenic effects. Safe in moderate doses. Herbal and natural remedies. Eucalyptus oil, steam inhalation. TGA category. B2, FDA. Not classified. Mode of action. Relieves throat irritation. Clears airways. Evidence. Safe for topical use and steam inhalation. Ingestion not recommended due to toxicity. Third-line treatments, lower safety or insufficient evidence. These are less supported by evidence or carry potential risks in pregnancy. Mucolytics. Ambroxol. TGA FDA category. Not classified. Some sources suggest that Ambroxol falls under category C. Muco S. R 75 mg. Ambropro 20 mg lozenges. Avoid in the first trimester due to potential fetal risks. Tyloxipol, eprazinone, stepronon, and letostyne. TGA, FDA. Not classified. Limited or insufficient pregnancy safety data. Avoid unless necessary. Not recommended without sufficient evidence. These have insufficient or conflicting data and are best avoided in pregnancy unless absolutely necessary. Pelargonium pseudoides. Limited evidence. Avoid during pregnancy. Licorice root extract. Prolonged use may affect fetal development. Potassium iodide. May affect fetal thyroid function.